Madam Speaker.
Dr. Nyati.
Oh, I know. Uyabonakala namhlanje.
Uyabonakala namhlanje, so the view is okay today.
No, it is. Yeah, it is. Ingathi ungahlala phezulwanyana kancane nje.
Okay.
So that, yeah, if bebekunekhutshinanyana bakunikeze nje ungathi uyaphakama kancinci. Yeah, that position. That one is better.
Is this better?
Yeah, that one is much better.
Okay.
Yeah.
Okay.
Yeah.
So we are improving with time, Dr. Nyati.
We have to. We have to, but the support team that you have availed, it's yeah. The lady who's in your office is actually quite good.
Oh, okay. And
yeah, but I think I mean the poster, yeah, this thing is also very nice.
Yes, I just saw it. I was busy with some other things, but I looked at it. Yeah, it looks good. Yes, thank you so much.
I'm a meditator because
thank you for the mentoring.
Okay. We're waiting for everyone else then.
Okay. So the position looks okay now.
Position is perfect. Was kuphela.
Oh, all right. Okay. Sister.
Mr. Masih. Yeah, speak. I just want to hear if your sound is good. We've got 5 minutes to go.
And we can't hear you, Mr. Maseko.
Hi, good afternoon, Madam Speaker. Hi, how are you?
Good, good. Thanks for you, Mr. Maseko. That sounds better.
Okay, thank you. Okay, I think I'll set it up like that.
Yeah, you're very clear from that position.
Okay, thank you.
Yeah,
thank you.
Very, very clear.
Thank you very much. I hope
our guests are not yet here. Let's hope they will come in.
Okay, let me check up on them.
But if they come in later, I think it will be like yesterday. Sipo will have to welcome the people, and then you know, get you to make opening words or statements, speaker. You know, before anything goes. Yeah. So it was. I don't know. They are all supposed to be in now, but
yes, I hope by the time we set up a tone and making an opening statement, they would be here. At least one of them. Let's hope they are making their way in.
Okay. I wanted to write down the numbers that Doc had given us yesterday, and just show them on the screens as I was hoping I'm gonna do something like this, and then maybe write there's a few telephone numbers.
okay.
You know, like how they do on TV as they appear at the bottom of the screen.
Yes, that would be great.
Okay, let me try and write them down. I've asked Ushuga Uloiso to follow up on the guests to see what's going on from that side.
Okay. We've got 3 minutes to go.
Okay. Okay. Let me just write down that number. It doesn't they don't look like they're in as yet.
No, don't worry. I think the speaker will make you will do your introductions. The speaker will give opening statements relating to the topic of the day. If they are not yet in, then I may come in and add something, you know.
Okay, perfect. Perfect. Okay, 2 minutes to go. Okay, almost time. Okay, we're almost ready.
Go in.
We're ready. Okay. Thank you very much to everybody who's watching and following this conversation. It's the talk with the Speaker of Council, Menongeba Modwele. My name is Sipho Masigo, and I'll be mediating this session. I'm joined by the Speaker of Council today, and also joined by Dr. Nyati. Today we also have two of our guests who will be joining us in a short while on Zoom. And we're just trying to finalize just their connection. And we'll be joined by Kosi Gianni, who is a clinical psychologist. We'll also be joined by Tabang Tlaka, who's also a clinical psychologist. And today on the show, on this conversation, we'll be discussing mental health during COVID-19 lockdown. And this is a follow-up session that is a series of conversations that are arranged by the Speaker of Council, Menongeba Mondwele. And yesterday we discussed a very interesting topic as well. And a big thank you to Dr. Tlaleng, who was very informative, who has shared with us a couple of numbers that I would like to show. And I hope that I can display them and I can just go through them quickly. For those who may have missed the broadcast, that the Commission for Gender Equality, you can call them if you are in a relationship that is a very abusive, is a child or a family that you know of that are going through domestic or gender-based violence. There's a number that you can contact. It's 0800 007 709. That's CGE's contact details. We also have childcare, which is 0800 055 and 555. That's childcare. And we also have GBV, which is the command center. You can get a hold of them on 0800 428 428, or you can call or dial *120 and 7867. So those are the numbers you can contact so that you can assist either anyone in your community who may be going through a very tough time. So today we are discussing the issues of mental illness, and I would like to give this opportunity to Madam Speaker. Thank you very much, Madam Speaker and Dr. Nyati, for joining us. Madam Speaker, thank you very much. If you can give us an overview of today's discussions, please, Madam Speaker.
Thank you very much, Mr. Masiho. Thank you very much, Dr. Nyati, and thank you very much to our clinical psychologists who will be joining us shortly. Mr. Masiho, I think my understanding on mental health is that, as it is a topic for today, is that mental health problems could affect one's thinking mood. It can affect the behavior of individual, and it can affect our psychological well-being. So that is my little understanding about mental health effects. And in a wake of COVID-19, we are facing a new reality, a reality of lockdown, a reality of social distancing, a reality of self-quarantine and isolation for some people. And the new circumstances we are faced with as a nation may lead to people with mental health concerns into heightened symptoms of anxiety as well as depression. Some people might have had mental health concerns or difficulties in their lifetime. And considering the level of attention and seriousness being paid to COVID-19, I think it's normal, Dr. Nyati, for one to feel anxious because of the situation. And the question that I would want us to address, so if you feel anxious, do you ignore your feelings? Or how do you deal with the feelings? And how does one, if you have to ignore it, how does one ignore or suppress the level of anxiousness? So I think we need to discuss about that. How does one also suppress thoughts, as every time one ashebile TV, or the news, or the figures that are increasing on daily basis of people who are infected, and also the numbers of people who have already passed. So how do you then deal with that anxiety? Or how do you suppress it or ignore it if you have to? If you have reached a level where you have to be quarantined, the psychological impact your quarantine can have a substantial, and it can be long lasting. It can be substantial or long lasting. So how do you deal with that? And especially for people who have, like I said, who have existing mental problems or mental challenges, how do they deal with it? Even people who don't have existing mental challenges, how do they deal with the situation as is tola or as is fumana sikuyo at this moment? Isolation sometimes, I think it's like a confinement. The loss of usual routine that you are used to as a person, and a reduced social and physical contact with others can be very boring. So how do you deal with that boredom? How do you deal with the frustration and the sense of isolation from the world and from the people you love and from the people you are used to socialize with? So, and then more worries if you experience physical symptoms potentially related to the infection. I can make an example. One day I went to the mall next door to get something to eat because the fridge and the cupboards were empty. I had to go and get something for the kids to eat. And at the passage, at the mall, but not next to me, on the other side of the passage, there was a person who was coughing severely, but her mouth was covered. But that psychological thinking and that thing, you know, this, I might be infected by this person, as much as the person was very far from me, but that on its own created a psychological problem in my mind that by the time I arrived in Endlini, my head is heavy, I have headache, my chest is not well, and you know, sometimes you boil hot water, you say, yo, my neck is not feeling well. So that psychological thinking, how do we deal with it? How does the society deal with the impact of COVID-19 into their psychological well-being? I think that's the topic that I would want us to discuss and get some expertise from the participants who are participating here today, who are experts in the field of psychology and depression, anxiety, and that, so that sikhona ukunceda isociety and abantu bethu. Again, I want to repeat what I said yesterday, Sipho, that as the discussions esinazo with platforms, we must pitch them into different levels. Pitch them at a high level, but as well pitch them at a level where an ordinary gogo onabantwana abazokwazi ukumfaka ku social media amamele this conversation, understand ukuthi how should one behave and how should one control or behave in this situation that we find ourselves in. Thank you.
Absolutely, Madam Speaker. Thank you for that. Dr. Nyati, I think as well you can please just your intro with response to some of the issues Madam Speaker has touched on that are very critical indeed with our conversation today.
Yes. Thank you, Mr. Masiko. The speaker, she just sounded like somebody who has got some crash course in medical school. You know, she was just so she was just so on point, you know. Her opening statement is actually in line with what I wanted to say. You know, this is month 4 of this pandemic. You know, as we know, it started in China, you know, at the end of December last year, and it has now spread throughout the whole world. Now, as we were, you know, still getting to a point where we didn't really have cases, we, you know, in the medical field, had to look at what's happening in China, what's happening in Iran, what's happening in Italy, so that we can learn something from what was happening in those countries, so that by the time it hits our own country, we are at least, you know, better prepared to, you know, to deal with this issue. Now, one of the things that has come out, there's been a lot of research that has been done already in China and also in Iran. And basically that research amongst the people of China, amongst the people of Iran, is showing that even if people were normal, they didn't have any pre-existing mental illnesses, the whole fear around the pandemic caused moderate to severe levels of psychological impact. They actually said just over half of the people surveyed in that part of the world already had problems with, you know, psychological impact of the pandemic. They also found that at least a third of the people, these are people who did not have any pre-existing problems, they had a lot of anxiety symptoms. That's about a third of people. And that confirms what the speaker has just said already. They also found that almost a fifth of the people had depressive symptoms. All right. So that is 1 in 5. And these are people who did not have any problems before. But what they also found is that amongst people who already had pre-existing mental illnesses, a number of them, because of the added stresses and the worries and the anxiety about this pandemic, whether they will also be victims or whether their loved ones will be victims, and the lockdown, what is it gonna do to their jobs? You know, will they still have jobs after the lockdown? And the businesses, will the business still be able to take off? You know, so all of those things, the uncertainty of how long the lockdown will be. So all of those things that they experienced, we are now experiencing here in South Africa. People are anxious, people are depressed, you know, people, you know, are unable to deal with the, you know, with being isolated and locked down in their homes. And so all of those issues are issues that are affecting people today. Other people, because their businesses are closed, they are worrying about financial matters. You know, how am I going to make ends meet because I've not been working for 3 weeks? You know, so those are just some of the issues that, you know, those are just some of the issues that are facing people, and these are real issues, issues that can't be dismissed. So I'm just, you know, supporting the opening statement by the speaker to say it's a real issue. People are stressing, and they're stressing for good reason. People, when they watch TV, they listen to radio, we hear a lot of negative news. So many cases, we've gone up now to 2,500. There's been 34 deaths and all of that. The prison in East London, there's so many people and it's spreading to the communities and all of that. So all of that negative news, at some point, people get to a point where it becomes too much. So anyway, can we maybe welcome Usisi because she has just joined us?
Absolutely. Thank you so much, Doc. And let me also take this opportunity to welcome Usisi for joining us, Kosi Gianni. She is a registered clinical psychologist and an expert with more than a decade experience in facilitating and coaching transformative learning interventions focused on influence, crucial conversations, negotiations, accountability, and change. She's got a very long profile, and I think I'll just end there and say thank you very much for joining us, Sis Kosi. Thank you so much for joining us on this conversation.
Thank you so much, esteemed colleagues. It's great to be here.
Absolutely. Doctor has just given, I think you joined us when Dr. Nyati was on the floor, just giving us a bit of a background. It started off with Madam Speaker, also just giving her opening remarks. And, I think you can just jump in as well, just to give us a bit of an understanding to what does the state of South Africa look like at the moment when it comes to the issues of mental illness, especially during this lockdown? I know Doc mentioned other countries. Perhaps you can also jump in and give us just your outlook on the state of mental illness in the country.
Okay, I think I will echo what I heard from Dr. Nyati. And I think we have been progressing. And at the beginning of this pandemic, I was talking about how we need to appreciate where we are as a country from a stages of a trauma, an unprecedented trauma that we are experiencing, that none of us could have prepared ourselves for this. And in the run up to the lockdown, there was that anticipatory anxiety. Yoguchi, what is this thing? Because we are told about an enemy that's out there lurking at your next move. It could just be the wrong move. But we don't see it. And I'm supposed to be scared of it. I've never seen it before. I've never heard of it before. What do I need to do? I can be sitting and minding my own business, and yet I find myself, on the wrong side of this enemy. And so there was a lot of that anxiety, but also we are in a state of shock. We were in a state of shock, and we were in a state of denial, and hence the behaviors that we saw being put out in the media about, people pushing against the lockdown, because psychologically people are feeling overwhelmed. People were just saying, I cannot take this in. I'm just bombarded with a reality that I have no space for. Nothing in my world before has prepared me for such an occurrence. And so where do I find the space within myself to open myself to take this in? And how do I then begin to shift my life to accommodate this reality? And then we saw a state of, once the reality sets in, and people then get angry. Because why are you now limiting my movements? I haven't done anything, and of course, the first time we get to understand this pandemic, we hear that it is a traveler's disease, so it is a disease of affluence. And people are saying, I've never even been on a plane. I have no clue where China is, and America and so on. So why must I now suddenly be told I can't do things I have been doing, without interference? And not only am I just warned, I just have a heavy-handedness of being, of this lockdown being imposed on me. Nobody has negotiated this reality with me, so there's been that anger. And anger simply means that a person has accepted, the reality has dawned, it has settled in. And so it's our way of negotiating, help me to take this in spoonfuls. That's what it means psychologically as we have that pushback. But we are at a stage now where the reality, the rubber has met the road. It is real. We have a better sense of it, more so because we now have living statistics. People are beginning to see people they can identify with, because at Kaleni, it was people that were so distant from us, we couldn't associate our lives with them. And now suddenly there are people we can relate with. They are normal people. They are people of our color. They are people of our socioeconomics. They are people of our racial, ethnic, and cultural, identity. So there's a resonance. We can see ourselves, and we can see this reality getting even closer. to us. It's no longer far. It is a step away from us. And so there's now the stress of the reality, as Dr. Nyati was saying earlier on. What is going to happen to my livelihood? We saw panic buying earlier on. Not everybody has the luxury of panic buying. And so people are saying, if I live hand to mouth and I depend on my daily bread, and I now suddenly am told I cannot go out there and fend for my daily bread, how do I begin to live? And people, the question is, we are caught between a rock and a hard place. So on the one hand, I need to go out there and bring the bread home, but I can't go out there because there is this thing that's going to, have this disastrous effect on me and my family. So it's a very hard reality to really negotiate. And unfortunately, the virus does not care about our religious affiliations, our social politics, our socio-economics, and so on. The virus is ruthless in that way. And therefore, it is about how do we then make sense and how do we make the most out of the worst right now.
Absolutely. Well captured that, Oskosi. And Madam Speaker, maybe to bring it back to you, I mean, you've heard both our panelists engaging us with the realities our people are facing at the moment. What do you think could be done from our side as government? Because I was engaging some colleagues earlier on. We were talking about how at some point mental illness is seen as a soft issue in some cases. People don't want to talk about it. We know it exists, and especially as Black people, we always think we don't understand fully mental illness. We don't understand things such as anxiety, depression. We know it exists and it happens in our lives, but what can be done from the side of government, especially from the legislature side, being the Speaker of Council and councillors? I know that they are going to be inundated with issues within their wards. What do you think could be done, Madam?
Well, thank you very much, Mr. Masiho, and welcome, Kosijiane, and thank you very much for your input.
Thank you.
Like you said, that it is a thorny issue, it's a difficult issue, the issue of mental illness, because I think doctors here today would agree with me that there are different kinds of mental illness, and they are caused by different reasons. But I want to agree with Dr. Gianni when you say that the rubber has met the road. So we are in a state of reality of saying, yes, this thing is here. But I think there is still a question of how do we deal with this thing? As much as we have accepted it, but how do we deal with it? Well, there are still some level of ignorance in some sections of our society. For example, just last week, I had some people saying, izifo zabelungu, and this disease is not as zifo zabelungu, as you said, that it cuts across race, religion, color, or it has no creed. So it used to be at a distance and now it is closer. So the first thing we discussed about as the legislature, we said, okay, the executive, firstly, the president, the premier, and the executive in our city have put interventions in place. They have put measures, like you said, that we had not prepared for this, but they had to think, on top of their fingers to say, okay, now we need to look at people who are disadvantaged. We need to look at people who are not only stressed by the pandemic, but who are now stressed by the conditions they are living under, to say, okay, if now we are told to be locked down, social distancing, not to go, not to do this and that, where are we going to get a plate of food? Yesterday we were talking about ugogo othengisa amagwinya estradeni, and who is earning a living and having a plate of food by selling amagwinya estradeni. So now with the lockdown, even though the regulations have been at least eased, but still people who are selling cooked food are still unable to sell on the streets. Only the fruit and vegetable informal traders can trade. So what is it that we can do? Then our local government in Johannesburg in particular had put in place measures. They have delivered water tanks to those people who live in the informal settlements who did not have water in their yards. They have also embarked on a food program where people have to be given something to eat on a daily basis. So that is what government is doing. Then we said, as the legislature, we need to make sure that people bring this disease, as Kosi has said, closer to themselves. One, people accept that there is a pandemic, and people also accept that this pandemic is here. It's not there. It is within us. So we said we need to embark on an educational program so that we educate citizens, one, about the disease, two, how to prevent, because prevention is better than cure. I think the doctors will agree with me. How to prevent infections from the disease. So the education we are doing, it's about educating people on how to behave, social distancing, and those things, and also to support the programs and the interventions that the city has put in place. Yeah, I see Thabang Tlaka has joined us.
Thank you. Finally. Yeah, so I'm here. No, thank you. Yes, sir.
Okay, I'll introduce you in a short while. Madam Speaker, are you done on your side so I can do an intro on Thabang?
Yes, thank you very much, Sipho. I am done.
Okay, Madam Speaker, thank you for that. And I think it's good that to hear that there are some interventions in place from the side of government, in particular, the city of Johannesburg as well. And at this point, I think let me take this moment to introduce Thabang to all our viewers. And Thabang, thank you very much for joining us, Abuti. And Thabang is Thabang Tlaka, it's his surname, and he holds a master's degree in clinical psychology from the University of Pretoria. He is a father of 2 young girls, a communicator, and Mandela Rhodes Scholar. He is the author of Taxi Philosopher, Corrupting Virgins, and Selfie of the Soul. Wow, interesting ones. And together with his wife, Dr. Zanele Tlaka, they have established a creative hub called the Crazy Poetic Ministries. And he's also got a very long list. I'm looking at his profile. He's met the likes of Ntate Nelson Mandela. I see here the likes of DJ Fresh and a number of people and activities that he's done. So Thabang, thank you so much for joining us today. We really appreciate your time, sir.
Thank you very much. Introductions take very long, huh? Yeah.
Celebrity, thank you. Thabang, we've, we're talking this issue of mental illness in our country. It's a sad state of affairs that we see and find ourselves in. Both Dr. Nyati, Leos Kosi, Gianni have given us, and Madam Speaker opened up by giving us a perspective as to where do we find ourselves as a country and the issues we see. We'd like to give you this moment to also just give us your perspective as to the state of mental illness in our country, with the result COVID-19 has brought to us as a country and as a nation and as a whole world. What is the state of mental illness in your view in the country?
Yeah, no, thank you for the question. I think people are struggling, since the lockdown was announced. I think people were initially struggling with that, initially struggling to how will I cope? How will we survive 21 days? I think that was the initial concern. However, with time, there are other concerns. We see people who've been diagnosed, who've tested positive for the virus. They themselves, I mean, they cannot get visitors. They are not, there's a stigma attached to the illness. So they also need support. So there's a lack of support. So people in that space are also struggling. Their families of people who've been diagnosed or people who've tested positive, they're also struggling. They're not getting support. They are the workers, the frontliners, the first lines, the nurses, the doctors, the guards, the soldiers, the police, who every day have to wake up and go and address this issue. So there are people who are now concerned about the PPEs. There's a concern about not having enough protection. So you have that. Then the other thing is, we already had people who are struggling with mental illnesses. We had people struggling with depression, people struggling with anxiety, and those people, those who are struggling with, say, post-traumatic stress now disorder and anxieties, that has seemed to also have heightened now, because if you had issues with contamination and germs, now you have to be extra careful with wearing masks and covering your hands, your gloves, sanitizing. So we see that people are struggling with that. And I think partly some of it is there's also some, I suppose, ignorance. I'm observing to some level. There are some people who seem to think that this is not as bad as it is. This is something that people are struggling, are sort of still getting used to. And I do predict and foresee that with time, there are going to be serious challenges, especially around bereavement as well. When people are starting to, I mean, now if you have a funeral, only 50 people can attend the funeral. So there's a bit of that. So you're observing in different parts of our society, people struggling to just make sense of what's going on. But there are problems that we are observing.
Absolutely. Thank you very much for that, Thabang. I don't know if I've caught you, but I just I see a bit of a transmission loss there. But thank you. I think you've given us quite a lot. And Dr. Nyati, maybe to bring you in, I mean, Thabang has raised quite a few issues there. Just also your input in terms of what he has raised, especially around issues of funerals. Where you find that you are now limited, as he had said, 50 people per funeral. The last one I had attended, I came back to explain at home that it felt very cold because, it's difficult to even love or hug somebody who's just lost their loved ones during this time. And just the sitting arrangement at the gravesite at the last funeral that I attended, it was so cold and it was just so un-African. And I don't know how badly it may have affected the family that there is no interaction. And because we were also streaming the funeral, we had to be very mindful that we we meet the guidelines that government has indicated to us that we should have. And and people were very cognizant of the fact that we are streaming. We can't hug, we can't shake hands, we can't stand too close. And it was just very cold. I mean, just your input maybe further on this topic, Dr. Nyati.
I think, let me take a back seat. Can you have Usis Kosi? Let me take a back seat. I don't want to monopolize the platform.
I was also a bit concerned about me doing that earlier on in my intro, and hence I didn't quite fully, respond to, I think, the questions that you had tabled before me. So I think, the one thing that is happening is that, in short, I will say it is business as unusual. So we are meeting a lot of first time this has happened. It's of course the first time that somebody in our family will have been, infected by this virus, and therefore the domino effect of that is that everything that we now have to do around the fact that we have now lost somebody. First of all, as you say, the fact that when a person, I think Thabang was saying, when a person gets hospitalized, the normative thing, Yobuntu, just humanity, is to go and see them. It's to comfort them. It's to be with them, to support them. The least we can do is be present with them, to express our empathy, to express our compassion, to express our loss, that they still belong with us. And we therefore feel their presence and their absence, and we therefore will be with them. And we can't do that now. So you can only imagine also what it means for that person lying in that bed in hospital, with not knowing what their prognosis is going to be, whether they're going to get better or whether they're going to get worse. And them, of course, lying there, being concerned about the possibility that they may have contaminated others in their family that they love. So they're worrying about themselves, but they're also worrying about the people that they've left behind. And those that are at home are sitting there worrying about the person who's in hospital, but worrying also about the possibility that they themselves may be infected. And how do it then redefines, how do we care for one another in this new space? And it cuts into the core of who we are as human beings, because we are social, relational beings. That's what makes us Abantu, as opposed to Ilwane. It is that our sense of connection, our sense of belonging, compassion and empathy, and the fact that we gather around each other whenever something like this happens. But right now, we have to do the exact opposite. So it negates everything that has defined who we are as human beings. And let me pause this before I also monopolize the space and allow Thabang and Dr. Nyati.
Young blood must continue.
Well, yes, that means you, Thabang. That's definitely not me.
Thabang, you wanna jump in?
Yes, I was just saying, as Siskosi has explained, I think there are things that just come. We've traditionally went about burying loved ones in a certain way, and the world has changed. And going forward, we have to do things differently. And so to navigate that, it is quite a task for us. So one of the things that we'll have to be doing is to learn how to do new things. But in the initial phases, we are going to struggle a bit to adjust to what is happening. However, it's something that we have to think about. We are going to have to think about, how do we do things in a different way? What's our new normal in terms of relating, in terms of grieving, cyber mourning, how do we organize then funerals? How do we connect? So that is quite an adjustment that is coming, but it's something that we're going to have to learn to do.
Yep.
But then Sipho?
Yes, Madam.
I hear Thabang when you say that we need to learn to adjust, and especially when it comes to our traditional practices. Funeral was made as an example here by Sipho. You remind me of one friend of mine who said, "Na, I gave a talk during this time, yeah, COVID, because I want speakers at my funeral. I want people to say things about me. I have lived long, and I want people to talk about me." So then, after COVID-19, then that's the question that comes when, as you were speaking, Thabang, Kori, after COVID-19, will life go back to normal, or we will still have to adjust and have new practices than our normal? So how would, I can imagine how would life be after this? But I think what we need, we might not have all the answers, especially on the psychological well-being and how this whole pandemic will leave us psychologically after this, but at least we need to say, this is how you should. I said earlier on when I was opening that do we ignore the situation we find ourselves in, or do we suppress our feelings, or we entertain our feelings, but then what do we do? Because I think viewers there, they're asking themselves, okay, these people, what they are saying, it's real, it's what is happening to me, but then what do I do?
If I may, I think the one positive in this challenge, in terms of the picture we've just painted, in the overhaul of how we've always done things, is that moments like these have always come in the human community. So we need to recognize Guti Lasikona, Axila Sakala Kona. So there's always been change. There's always been movement. Some of the changes, for example, the fact that Imingwabo have taken this long, Guti Klali Vigi and so on, part of it is the legacy of a migrant labor system. Whereas Emakaya, these are not things that we used to do. You know, so we need to be able to stretch ourselves and make the necessary adjustments, especially because I think the one thing we all understand is that we have a common enemy. So it's unlike a person might be able to say, so-and-so agezanga to show sympathy, to express sympathy with the fact that Gushoniwe. We all will understand if people do not do that. That it is not because abantu bebenga funuguza, but sonke we are under isimo that we all need to respect. And it is, we have to do the barest minimums right now in order for us to survive, so that we are able to get to survive and be able to redefine our lives. And I'm going to say something very controversial here. Please give me the space too. The one thing I'm hoping that this will do is, I have a problem. I've had a problem with the size of funerals we tend to have. Imingwabo yetu are labor intensive. They are unnecessarily labor intensive. They are unnecessarily financially intensive to the people who have the least resources to carry this. So I'm hoping that somehow this shakes us to some level of sobriety. And I have said, I really do not understand, Uguti, how we inconvenience ourselves, Elokshini, because there is a queue of like 100 cars that are going to the cemetery to do what? To do what? So I am hoping that we can stick with this 50, and I hope that government makes a decision with, let's stick to this 50. Let's just trim. That's too many frills. And these frills have socio-economic implications. Let's find ways. Let's redefine what it means to show support for each other. I just think, and I know this is controversial, but I think this is a good opportunity for us to revisit what we still need going forward. And what do we need, and what are the extra frills that we really can cut out? I'll stop there for now.
Absolutely. I want to bring some of the viewers in. They are engaging with us and they've sent through some questions.
Awesome.
Yeah.
And we're saying that how does one see or sense that people who are close to us have mental illness? How do you know that somebody has mental illness? Maybe Tabang, you want to start with that, and then we'll come back to you, Kosi, to assist with that response.
Okay. So part of knowing what is wrong with somebody is that when we interact with people, we generally have a general understanding of who they are, or of how society and individuals should interact. So if a person that you normally relate with starts changing in a way that is negative, in the sense that they are not able to do and function in the way that they used to do, say their work is getting affected, their education is getting affected, their relationships are getting affected, they're behaving in ways that are detrimental to themselves. So they are shifting from the norm, you know. So once you set, then there's something that needs to be looked into. And then a lay person can't really determine if this person has a particular, say, mental illness or mental disorder. So they might be referred, or you might suggest that they might see a professional. The other thing is that sometimes we can tell by when you're starting to relate with somebody, there are interactions that are cause us to, when we feel, say, maybe abused or manipulated, or sometimes when we relate to people, this relationship doesn't work out so well. So once you have those intuitive, say, suspicions or things that you notice, then you might want to follow up. So the main thing is that there are signs that you might pick up. The person's life has either changed, or in the way that they're relating to you, there's a bit of a problem. So you pick up those, but then a professional will need to then confirm what that is, so that then therefore we can say that it is in fact a mental illness, a mental disorder that the person might need assistance with. But you might pick up red flags that will need to be followed up on. And they can be specific things or suspicious things that you might be observing.
Okay. Dr. Nyati.
All right, just following up on what Thabang has just mentioned in relation to the question. I think one of the things, it's not always easy to see that a person has a mental illness. However, what Thabang has just mentioned, a change in behavior, is one of the giveaways, or in the workplace, yes, a change in their productivity, it could also be an issue. Now, what I wanted to point out was that most often you have what we call life events, life events. Now, there's some very clever psychiatrists from the US who about 52 years ago came up with a model that ranks life events in terms of severity, starting with a loss of a spouse, rated all of these against 100, being the most severe, followed by divorce, followed by separation, followed by a loss of a loved one, and all the way, relocation and whatever. So sometimes if you are aware that there has been a life event in that person's, a life, obviously depending on the severity, those create a stress within that person, and depending on their coping mechanisms, some of the people may then not be able to handle that stress and progress to a point where they have a mental illness. But I'm not saying mental illnesses are always following life incidences, but I'm just trying to say, when you see that somebody has just had a life incident, has just gone through a divorce, or has just lost a loved one, or has just lost a spouse, has just relocated from Port Elizabeth to Johannesburg, has got a sick person in hospital, and during this lockdown, they are not even allowed to go and visit a loved one who is sick in hospital. So when there is such a life event, anticipate that that person may not deal well with that situation. All right. Some people are good at hiding, their feelings. However, as yesterday I talked about, let's be our brothers' keepers. Let's be our, sisters' keepers. So you don't wait for somebody to come to say to you, I have a problem. You anticipate that that significant life event is surely going to affect him or her, and you go there, and sometimes you may not have any wise things to say to them, but just being there and listening could just could go a long way. But obviously, once it affects their day-to-day function at home or even at work, then it needs professional intervention. because it means your own coping mechanisms are not enough. Some people may have had an incident, was what I spoke about now, about the rating of the stresses. You know, they normally look at within a 12-month period or 12 to 18 months period, what life events have you actually experienced? And if when you add them up, they go beyond, let's say 150, you know, then they already see you as a high-risk person who, even if you're not having a mental illness already, you need help. Now, some people may not deal with their loss now, or maybe there's a loss they had a few years ago, and then they have another one now, you know, and you find that that which they had suppressed together with this, sometimes we talk about double mourning and all of those kind of things. So the point I'm trying to make is, one of the important things to note is when there's somebody who has gone through a life event, anticipate that there may be challenges and try and reach out. They may not always be willing to open up and talk, but at the right time, they may talk. But at least that you've shown that I'm here, you know, if you ever want to talk, I'm available. And you just observe their behavior. And at a certain point, if you really think they are not coping, but they're not coming forward, then that's when you could advise them to seek professional help. I just thought, let me just come into that point.
And I think the one other element, sorry, Madam.
Absolutely.
I think the one other element that's very important to highlight, Uguti, in our communities, a lot of what ends up at the medical doctor's rooms, in Dr. Nyati's rooms, is actually psychological problems. The problem is that we tend to take ourselves for granted. And what I mean by that is, it is only magubhlungu isandla. You see, the thing about physical illness is that you can point at it. Kubhlungu la. There's always a place where you can point. But the problem with psychological issues, kubhlungu guphi? Uzokhomba ngophi? You know, but people think that that's a physical thing. And of course, ultimately, it will become physical. And hence, a lot of the psychological problems end up at the GP's practice. And only the GP will then reroute them to the source, which is the psychological. And it is then important for people to understand, Uguti, it is never always just one or the other. In other words, it's not just medication or just psychology, that these are complementary. And we need to understand that there is the body that is physical that may need, because hormones get depleted, you may need the medication to help you. It's kind of like a jump starting a car, but you will need therapy for that car to keep running. And that's how the two complement each other.
I thought the speaker wanted to say something.
Madam Speaker, would you like? Yeah.
Yeah, thank you very much. I wanted to, okay, when I was listening to Dr. Nyati talking about the life events, it was like you're talking about me as well.
Oh.
No, I want to add on the professional intervention you have spoken about, which is the truth. But I think the reality is that in our society in particular, mental illness is still not understood the way it is supposed to be understood. It is still new in our society, especially our African society. And the acceptance that one has, even if there are some societies of some families, even if they see a change on a person, but they would not be able to give that support. I think more than a professional intervention and a medical intervention, but a person who suffers or finds him or herself on a psychological challenge needs to be supported by people close to the person or family. I know when I was young, when I grew up, there were people with mental illness whom sometimes you would meet on the road or you see, and people would like, oh, uyahlanya lo, uyabo, hey, so phambene ngoku, or watsenwa. And sometimes a person might develop changes. Then even the very same family members maybe would say, hey, so uyahlanya. And then the person then holds back because usaba ukuthi kuzothiwa uyahlanya or uphambene. So I think we still have to do something for our society to understand psychological illnesses or challenges and how to support, because I think support goes a long way even before you can get a medical intervention.
Thank you very much. May I add something there? Yeah.
Before you add, my brother, maybe just to tell our listeners and viewers that we will extend this broadcast by another 30 minutes. The comments are coming in full fast, and clearly this is a topic of interest to many. And also just to thank Tata FM, they've indicated to us that they're going to broadcast this particular discussion. They've shared it on their platforms, and Kofifi as well. And thank you very much to those particular radio stations for really just taking an interest in this particular broadcast. So we will extend it by another 30 minutes. We have a lot of comments, and Abuti, you can take over. Please do make your comments.
Yes, I just wanted to add, I quite enjoyed the different points. The other one is, I think in our community, sometimes we think mental illness is not real, or as they would say, motuna le matepe. So a lot of people actually question mental illness, and we usually put it in the category of a person must have some sort of psychosis and have outward signs of a mental illness. It's such a broad mental illness is such a broad subject that people who struggle with, say, anxiety and fear. There are people who struggle with mood disorders like depression and bipolar. There are people who struggle with personality issues. So it's not a small thing. What I want to say is it is real, and it is true, as Sis Kosi has also said, that sometimes the stressors that people take to the doctor, sometimes you find there's a psychological element to it. And the last thing I wanted to point out is sometimes people know that they are struggling with things, and because sometimes they don't believe either it's real or the context, or they might not know how to articulate it properly. So my encouragement is, if somebody thinks that they've got something that they're struggling with, that they should not be afraid to seek help or seek counsel or talk to somebody about what they might think that they're struggling with, because I still find that people struggle to admit or to seek help. There's almost a shame to help seeking behavior when it comes to things that people are struggling with, especially mental illness.
Absolutely. Just to take note of the questions, the first one or the second one is from Nompumelelo Hlazo. She asks, what plans do we have in place post-lockdown or even COVID-19? Because that will affect us drastically, economically, as a country. I'm thinking businesses will shut down, resulting in a lot of job losses, which will result in a lot of depressed families. Marriages might be affected negatively, where we might see an increase in divorces. Kids will be affected heavily. And yes, nobody prepared for this. That's the first one, or the second one. And then another one from Lebogang Tebogo Pesha says, mental health amid COVID-19, interesting dynamic, we shall overcome. It's just a comment. There's a few, but let's deal with those ones. And maybe, Oskos, if you, Doc, do you want to take it first?
Yeah, no, I just want to make a comment, and this is a challenge. Generally, as a country, South Africa, as a country, we are not doing very well when it comes to issues of providing mental health services as a country. I mean, if I look at the annual spend by the country on matters of mental health, we don't spend more than 5% of the total healthcare budget. Now, and when you look at provinces, because that's where health services are delivered. You know, the mandate of delivery is at provincial level and also at municipal level. It's not at a national level. Now, when you look at that, you know, the various provinces, you know, you find that there's not enough of dedicated, you know, facilities for proper, you know, professional care when it comes to matters of mental illness. And here I'm talking about, you know, because it's normally just, you know, put in with all the other general illnesses, and then where people can stay for 72 hours and then maybe they are sent elsewhere. So post-COVID, with all what is happening now, yes, now there is going to be a new hospital, you know, temporary hospital in Nasrec for people who are acutely ill now. But we need to look at exactly the same type of approach of creating facilities to deal with the, you know, the aftermath of this pandemic, where you're gonna need a lot of, you know, mental health interventions for the mental health care users. So we need to plan for it now as a country, divert some of the, you know, the funds for the healthcare, because without doing that, and by the way, 80% of our people rely on the public healthcare services. And so that's the area that needs to be strengthened. Yes, private sector is available, but we only have 17% of the population that has got medical aids to be able to afford that. And even with those medical aids, the benefits for mental health care services are so thin that even the regulator for the medical schemes has to find a way of strong arming the medical aids to put better benefits for mental health care services in the private sector. The idea that you can only have one admission of 21 days when you've got a major mental health illness, if you have got another episode within the same 12 months, it's almost impossible that you can get admitted. So the point I'm trying to say is that there needs to be a review of the benefit structure in medical aids to enable those who've got medical aids to go and get care. But the majority of our people who do not have the medical aids, who rely on the public health services at two levels of provincial and also like here, we, you know, at metro level, there needs to be a putting together of heads to say for the next 24 months, we are likely to see an upsurge of people who want this kind of services. How do we try and improve the facility? Maybe that hospital, when it's no longer dealing with acute cases, can it be used for the next 18 to 24 months to actually provide more capacity? You know, obviously the new model of dealing with issues of mental health is actually deinstitutionalizing people, meaning, you know, trying to assist people as outpatients, and only those who absolutely need to be admitted have to be admitted. But in all of that, we need to create capacity. And I think it is very urgent because there is definitely going to be a lot of issues, you know, divorces, loss of jobs, unemployment, and all of that. So that's my contribution.
Yep.
Madam Speaker, you want to take a chance at it before I allow Thabang to come in?
I think I'm covered by Doc. We can allow Thabang to come in, especially on post COVID-19 and all the economic implications that that have been alluded to. I'm covered on that.
Okay, Thabang?
Yes, thank you. I mean, I think we were at a crisis even before the situation that we are in with the COVID-19, because I mean, if we recall, we're dealing with gender based violence. We're dealing with a lot of mental illnesses. Just as a country, we were not managing in terms of how people understand mental health and are coping. And so I think post the COVID coronavirus, we are going to need a lot of like a systematic change. We are going to need a bit more various training centers we are going to need so that we can give people psychoeducation, so that we can do group work, so we can provide workshops. We are going to need to train actually more mental health professionals, because we're not even producing enough. I think each university probably produces about 12, less than 20 a year. So we are going to need a more concerted effort in dealing with our mental health. Even the schools are struggling. You don't even have enough educational psychologists. We have asserted in that children are struggling in school. They are being pushed. So we have an underdeveloped mental health sector. And if we don't do anything about it, we are going to struggle. So I think it's going to be all hands on deck, the whole system, and we are going to need just the financial resources and the human resources to be able to maintain the work that needs to be done. There is a lot of work that needs to be done, and but fortunately there are ideas. We just need to then implement those ideas. But there's definitely a lot of work that's going to need to be done.
Oskosi, you wanna take a chance at it, and then we can give Dr. Nyati to just respond as well.
Okay, I didn't want us to belabor the points too much amongst ourselves, so that we make sure that we get traction and get people's questions, and we are able to push through with that. Except to say that all of us have got to recognize that we are in a crisis. We have an economy that was already embattled. We have an economy that is hollowed out, that has been mutilated. We have just been downgraded. So the prospects were not good. So it is time for all of us to tighten our belts. We need to be clear about the difference between need and want. And we're going to have to do that everybody will have to do their own stock take of their own lives to say, what is it that I can do without? Because this is, even if COVID ends now, we're going to have the domino effect and the ripple effect still going on. It will continue to reverberate for at least the next 2 years. So we need to really tighten our belt and be focused. So things like debt and unnecessary debt, we need to look at all those things and really keep focus going forward. And yeah, I think I'll stop there for now so we can move on.
Okay. Just a comment from Lebogang says, but overcoming overcoming without hardships while grieving seems to be dominating the conversation. My worry is children whose routine has been altered, and are we gonna settles? And I mean, Tabanga, you've alluded to this point that there's not enough educational psychologists assisting at school level. What then happens? I mean, kids just feel like they are being cooked up or in prison. I came home the other day and the kids were like, Dad, what's life like in the outside? And, you know, I nearly laughed, but I realized that it's a real thing, you know?
Yeah, I think it's so important to have those conversations in the family. Children need to understand, Uguti, this is not punishment. This is actually, this saying no is an act of love. It is in their best interest to stay within and to then start going back to basics of how do we reinvent our world within our walls? Because I think one of the things that has happened is that we have depended too much on what's going on outside. What this opportunity invites us to do is to focus on what's going on within ourselves individually in the family, but also what's happening across us as the family. What is happening relationally, to reconnect with each other and to have the conversations about how are we going to support each other? What resources do we have? And resources, not just things, but how do we ourselves become each other's resources so that we can strengthen each other to make it through one day at a time to the next day. We are facing, and I'm not being a calamitist about this, I'm just saying the whole world is in a depression. That's an undeniable truth. We don't have the luxury of everything that we've had before. So we just need to buckle down. This is where we're going to have to make sacrifices, short-term sacrifices for long-term benefits. That's what it comes down to.
Tabanga, maybe you can answer and respond to this following one. Doc, I see, okay, maybe before I ask questions, Madam Speaker, you first, and then Doctor, you can follow.
Yeah, thank you. Maybe before the next question, to follow up on the interrupted routine for children, I think it goes beyond kids being locked at home. But also there are kids who are used to a classroom setup in terms of education, in terms of schooling. And now they find themselves having to get used to online learning, as well as looking at the programs on television for them to catch up. So that is also psychologically interruptive for kids who are used to a particular setup of schooling. So I think that as well, we need to look at over and above them being bored in a lockdown.
Doc, you wanted to say something?
Okay, yeah. No, as you know, I think now I just want us to also look at what's available now for people to get support. What's available now, and I'm sure you know the other guests will also be able to share what's available now. Remember, I mentioned that at least about 80% of our population relies in the public health system. So obviously, if you go there, you'll get the services. But there are also, you know, one of the things that has come out in China, they've found that during the pandemic, there was an increase of online psychosocial support services, right? Meaning people getting counseling services via telephony, via online, platforms, and again, getting counseling via Skype, getting counseling via various models, basically remote counseling. Now, one of the things that this pandemic has done is to actually force statutory bodies and even medical aids to recognize that remote professional services are actually, possible. And in fact, I mean, the biggest medical aid being Discovery has now, decided to pay, especially for, let's say, for medical services, that are remote for a full fee. So what I'm trying to say then is that because there are capacity challenges in terms of infrastructure, facilities, there needs to be a change again at regulator, not regulator level, both at regulator level and also the statutory bodies. They've been, not sure whether to fully authorize, remote counseling services. But with what we have seen now, the only things that work are those things that can leverage technology. And so even professional services must, leverage technology. In the places like US, there's an upsurge in terms of, people making use of remote or e-counseling services. So as a country, we need to actually do more on that area. So there is an entity called the South African Depression and Anxiety Group that is based here in Johannesburg. Its number is 011-234-4837. But there's also a toll-free number, 0800-205026. 0800-205026. All right. And for those with substance abuse issues, they also provide support. And the number is 0800-12-13-14. 0800-12-13-14. Now that's just one, organization that provides that, but Lifeline also does provide, and I think you've got the number from yesterday for Lifeline. If not, we will announce it a little later. Both these numbers I mentioned are available 24 hours, you know, so if somebody needs support, you know, that's important that they use those numbers. For those people who are working, you know, for those people who are working, especially those whose companies actually have what we call employee assistance programs. Programs paid for by the employer to provide counseling services to troubled employees, where people get unlimited telephonic counseling with professionals, and also up to 6 or 8 face-to-face with independent, you know, psychologists like Tabang or Siskosi, you know. So people, those who don't have those services within their employers, they need to agitate for that, because it's now part of wellness. And if they want productivity from their employees, they need to make sure that those programs are put in place. You know, and those who already have the programs, please make use of them, because we find that in many companies, there's underutilization of those kind of programs, and these are already paid for by the employer. So I just thought in terms of available support as we speak, I should share that information.
Okay. Thank you very much for that, Doc. I think we've got 14 minutes left, and what I propose we do at this stage is that the questions and comments are coming in full blast, and what I want to do is maybe if I give you a question, I'll maybe give Oskosi a question. The next one, I'll just give it to, so that we don't answer the same question at the all of us. So this one, I think I'm gonna give it to you, Oskosi. This one comes from Busisiwe Sebulai, and she says, post-traumatic stress disorder patients during lockdown, any suggestions for their situations? How do you deal, or how can people with post-traumatic stress disorder, how do they get help at this point?
So if we're talking about post-traumatic stress disorder, those people will most likely suffer from anxiety and or depression. And so what is important is that they make sure that they go back to the professional whoever is the service provider, or if they didn't have one, to find one that can provide online support through conversation, through assessing whether they need to have their medical regimen, you know, revised, or that they then will need to benefit from having conversations with a professional psychologist or counselor to be able to help them talk through whatever symptoms they're experiencing, so that they can then develop coping strategies. Because at this point in time, what's very important is to be solution focused. You know, so it's important to get clarity in terms of what is the person experiencing, and to be able to then say, what is it that's within your resources internally when as a person, or what support structure can you begin to, you know, to develop with the people who are close with you in your family. If uhlala nabantu, who else can we draw in to become your support? If not, who can you call? What are the people? What are your, you know, what we refer to as ICE in case of emergency? Who is it that you can call on to be your support, even if it means that they perhaps will need to call SADC, for example, because they may not know. But if you then find yourself in a state of panic, for example, who can you call on that can then become your stabilizer and be able to access whatever support they would need to draw on your behalf? But don't isolate. Okay. Yeah. Reach out to someone. Yeah.
Absolutely. Elias has a comment. He says, as adults, we can say we are coping, but when it comes to kids, it's a totally different story, because they don't know what's happening. My question is, what is the role of government in this matter if one needed assistance? Madam Speaker, maybe you can touch on it.
I think it is the same response that Siskosi has just given, that it is important that as parents, we also pay attention to the changes ebantwaneni bethu. and we seek assistance. We seek medical assistance, medical intervention, but we should not ignore abantwana. Mhlawumbe umntwana mayiqala, a child was not hyperactive, then all of a sudden the child becomes hyperactive. So we need to seek assistance and don't ignore abantwana. I think it's the same responses that Sis Kosi has given.
Okay. Doc, we've got one for you here. This one says, it comes from Nompumelelo. She says, Dr. Nyati, my worry is that there is nothing spoken about mental facilities post-COVID-19. I think yourselves as professionals in the field should take it up with government and have our country prepared before you are overwhelmed with mental illness. I think you touched on it.
I've already touched on it.
If you want to.
Yeah.
Yeah. All right. We have a question from Tebogo says, what then happens to somebody who has a mental has an addiction problem, is a heavy drug addict, and does it affect the state of mental illness? Maybe Thabang, you can take on that one.
Yeah, thank you very much. I think Dr. Nyati has talked about it. Yes, if you did have a condition for this lockdown and the situation we are in, it becomes heightened. So it is then important to use the facilities that we do have, that the government does have. One, present themselves to any, I think most clinics. If there isn't a mental health professional there, one could be sent to a hospital. There are also SADC, you could take that number. Lifeline could also assist in that. So if somebody did have a problem with substances, then you'd have to go to either an emergency if you've got a medical aid, or you could go to a clinic or a hospital, call the toll-free lines. You could also see a social worker if you need to be institutionalized, or if you need assistance like that. So one would have to just look at those resources, then one would get help.
Okay. Thank you very much for that.
Dr.
Just to
Nyati, did you have
also
your hand
appreciate
up?
and thank. Oh, sorry. Did you have your hand up?
No. I just wanted to quickly add, I know we don't have much time. The issue
Yes.
of people who have been using or abusing substances, whether we're talking about smoking, whether we're talking about alcohol, whether we're talking about hard drugs, including dagga, by the way, it's a hard drug, I know it's legalized for private use, but it's actually a hard drug. There are a number of NGOs that are available out there, like Sanka, all right? South African Sanka, and AA for alcohol, Alcoholic Anonymous, and NGOs like that. They play a very critical role in supporting, government, because they are partially funded by government. They play a big role in assisting people with addiction challenges. And with this lockdown, because people don't have access to those substances, they are obviously, having withdrawal symptoms from these substances. And as a result of that, they sometimes, are irritable. I mentioned this yesterday, and can actually, be involved in conflicts and all of those things at home. So it's important that if you've got a relative who actually has a problem of use of substances, who now is behaving differently, encourage that person to seek professional help. All right. And that, if it could be in the public sector or in the private sector, or leverage these NGOs that specialize with issues of substance abuse, because otherwise some of the complications of withdrawal, condition can actually even be life-threatening. So it's therefore important that those people get professional help.
Absolutely. We've got less than 10 minutes less than 5 minutes to wrap up our discussions. And I think at this point, can we just have closing comments from your side? Maybe Madam Speaker, you can wrap it up. can we start with you, Tabang? Just also, if there are numbers, if you can give us, I know Dr. Nyati has shared the numbers, we'll share them again. If you have any other numbers that we can share with our people, and maybe people, and Dr. Nyati raised a very critical issue that we can even do digital counseling in the same way. And I think in the same way, we are counseling some people, we are helping people. And if you yourself, Tabang, is able to provide any assistance, are you available? Can people get a hold of you? Where can they get a hold of you? That kind of thing.
Yeah, so the one thing I think I wanted to stress was, mental health is an essential service, and sometimes we take it for granted. So your mental health is your wealth. So to not be ashamed, to not wait for it to deteriorate. So if there's something that you need, please don't sit back and get help. So I'll be doing a couple of workshops just after this as well, so people can get a hold of me on www.thabangtlaka, that's THABANGTLAKA.co.za. I'm also on Facebook, on YouTube, on Instagram, on Twitter, and so I'll be putting up notices there as well. But people should not be afraid to get help, because it's very, very, very important.
Absolutely. Oskosi, maybe your side, same questions, really.
Well, I think my parting shot would be that when the going gets tough, the tough have to get going. We do not have the luxury of imploding on ourselves. And I know I may come across as being hard, but I need to be hard to say to people, we don't have the luxury of falling in and imploding on ourselves. We are our best resource that's available to get us through this. So never underestimate what it calls on you to be able to pull yourself through. You are your best, you are the person you are with the most. So really, this is a time to, Salas complain about us now. We don't have enough time for this, for that, for the other. Use this time profitably. This is a time for us to do that introspection, to do those reflections about what's working in my life, what's not working in my life, to redesign our lives. We have the time. So sit with yourself. Let's be our own best friends, because we tend to over-rely on other people to do for us what we are not willing to do for ourselves. So be your best friend, so that when times like these come, you are not faced with an animal that you don't know. This is the time to get to know ourselves better, to be familiar with ourselves, to be our own best company. There's that expression that always says, you need to love yourself enough so that nobody can starve you for love. Those are the times that we need to find that within ourselves and create the self that we want to be post-COVID. I think that's what I'm going to say for now.
Thank you very much. Dr. Nyati, maybe you can also have your closing comments, but also to touch on, in our closing comments, one issue tomorrow, we're having another discussion, but this time around, we are talking to faith-based organizations, healers, traditional healers. Maybe in your closing comments, you can touch on that.
No, you do that. You'll do that much better. All right. No, my closing comment is that my closing comment, two little issues. They're not little. One, we know that we've been hearing from medical people that there is a certain group of people who are high risk. All right. And the elderly are in that high risk group. So I'm just trying to say, with them already knowing, because everybody knows that they are high risk, their levels of anxiety are obviously much higher than anybody or people with pre-existing illnesses. So in our homes, if we've got elderly people or people with pre-existing conditions that are known to, to be high risk, let's keep a close eye on those people. I think that's one part. The second part is around, I'm challenging Usisikosi no Tabang, all right? because in South Africa, like I said, the issue of e-counseling has not been adopted like it has been in other parts of the world, like the US. I'm challenging them to actually ensure that their practices can offer, as an alternative to face-to-face, these kind of services. And luckily, both of them belong to a body of clinical psychologists that released guidelines in September about 2 years ago. There's normally a conference that they have on the second week of September. They've given guidelines on what should be done to ensure that the service, the standards are not compromised. So I'm challenging them and any other healthcare professional in the counseling space to actually introduce use of technology to expand the services because we've got a shortage of people who can do the good work that they do. So that's my closing statement.
Thank you very much for that, Dr. Nyati. Madam Speaker, you have the final say.
Thank you very much. Firstly, let me appreciate the participants, in fact, our panelists today. Dr. Nyati, thank you very much for your continuous support Gule civic education program yet, because this is all about civic education and capacitating our people. Tabang, really, we will definitely participate we program yako, workshop yako as you have given us. Kuba Mameli and the viewers at home, I would want to say to you, we should remain focused on the factors within our control. Izinto ezifana nokuhlamba izandla, ukwala mulomo wawukhohlola, when you are sneezing, and sihlale emakhaya as much as we can. Lastly, as we were talking about mental health today, self-care is critically important at this time. Care for yourself, as if you worry too much, then it can worsen things. There's a book that I've read that says, stop worrying and start living. I'm not saying we must not adhere and we mustn't forget what is happening around us in terms of COVID, but let us stop worrying and start living. Social support, things like eating healthy, exercise, find something enjoyable. And let us consume, Bantu Bagiti, proper information. Proper information, let us stop getting fake news and worry about what the fake news are saying. Let us try ukuthi information proper, and that can lessen danger, anxiety, and that can lessen stress because we will be listening to proper news. And I was saying to colleagues this morning, when I was talking to some people this morning who are my friends and colleagues, I was saying to them over the phone that, we tend to spend a lot of time watching indaba. Sihlala phambi kwe-ENCA or 4-5 TV, simane simamele izinto that are depressing us. Let us listen well, let us know kwenzakala ntoni in the surrounding. Maybe spend about 15 minutes or 20 minutes watching news and switch to other things. Sijonge movie. I'm not a movie person, but I've learned now ukuthi kufuneka ndibukele movies. So let us sijonge movies and other stories that can make us focusing to the stress, things that are stressing us. Let us have try and manage the situation as much as we can. But thank you very much to our panelists. I think our viewers have learned a lot, and those all of us who are going through this difficult times. But today, I think our lives will be different. Sis Kosi, thank you very much, Dr. Nyati. Sis Kosi, I think this is not the last time, and I hope that this is not the last time you are with us. So I think next time we'll have more time so that you can unpack your expertise, both you and Tabang, so that you can unpack more and people learn more from your expertise. Thank you very much, Sis Kosi. Thank you very much, Tabang.
Thank you.
Thank you very much, Sipho.
Thank you very much.
To Sipho for being for conducting this program very well. Siyabulela.
Ralebo.
Yep.
Thank you, Madam Speaker. I really appreciate it. Thank you, Dr. Nyati. Tomorrow we are back again, 4 o'clock tomorrow. Interestingly, Osco Celia Butabang will be discussing the issues around how do we at least engaging the faith-based organizations, Paporofita, Dingaka, that sort of thing. But when our people are going through the struggles that they're going through, how are they seen? Are they essential services? Just to engage, how can they assist us during this very difficult time? So it's going to be an interesting one. Doc, thank you very much. To all
Thank
our
you.
viewers, we really appreciate the support.
Sure. Thank you.
Thank you.
Cool. Thank you.
Mhm.